Hi, I'm Dr. Rezaian, a specialist in arthritis and autoimmune diseases. Today, we're diving into one of the most widely used but often misunderstood classes of medications, NSAIDs, or non-steroidal anti-inflammatory drugs. Before we begin, this video is for education and inspiration only. It's not medical advice. Be sure to consult a healthcare professional and double-check everything with trusted sources. In this video, I'll break down the most effective NSAIDs, ranked by potency, typical dosing, how long they last in the body, and when to use them or avoid them. Let's get started. NSAIDs work by blocking enzymes called COX-1 and COX-2, which your body uses to produce prostaglandins. Prostaglandins are chemical messengers that cause inflammation, pain, and fever. By blocking them, NSAIDs reduce all three. But not all NSAIDs are created equal. Some are stronger, some last longer, and some come with higher risks. So let's rank them, from the most potent to the safest for long-term use. Number 1, diclofenac, one of the most powerful NSAIDs available. Typical dose 50 milligrams, 2 to 3 times a day. Half-life, just 1 to 2 hours, but its anti-inflammatory effects are strong. Great for joint pain, especially in topical form. But caution, oral diclofenac has a high cardiovascular risk. Number 2, indomethacin, another high-potency option. Dose, 25 to 50 ml up to 3 times a day. Half-life around 4.5 hours. It's very effective for conditions like gout or pericarditis. But it has a high rate of central nervous system and GI side effects, especially in older adults. Number 3, ketorolac. This one is incredibly strong, comparable to opioids for short-term pain. But it's not for long-term use. Dose 10 milligrams every 4 to 6 hours, max 5 days. Half-life 4 to 6 hours. Personally, I avoid oral ketorolac because of its high risk for gastric perforation. Injectable use in the ER or post-op is fine, but strictly short-term. Number 4, naproxen. This is a great all-around NSAID. Dose 250 to 500 milligrams twice a day. 12 to 17 hours, so it lasts a while. It's safer on the heart than most others and works well for arthritis, tendinitis, and menstrual pain. Number 5, ibuprofen, one of the safest and most accessible NSAIDs. Dose 400 to 800 milligrams every 6 to 8 hours. Half-life around 2 hours. Good for headaches, fevers, and mild to moderate pain. Low risk, especially at over-the-counter doses. Meloxicam, ideal for chronic use. Dose 75 to 15 milligrams once a day. Half-life 15 to 20 hours. Once daily dosing and better GI tolerability make it perfect for long-term arthritis. Number 7, Celecoxib or Celebrex. A COX-2 selective NSAID, meaning it targets inflammation without harming the stomach as much. Dose 100 to 200 milligrams once or twice a day. Half-life around 11 hours. Very GI friendly, but use caution in patients with cardiovascular risk. Per op. Long-lasting, half-life is 45 to 50 hours. Potent but high GI risk. Once-a-day dosing is convenient but limits its use to select chronic patients. Prosen. Also once daily. Half-life 50 to 60 hours. Good for arthritis if onset speed isn't a concern. Nabimin, a prodrug that becomes active in the liver. Gentler on the stomach. Half-life around 24 hours, but not quite as potent as others. Ibuprofen and meclofenamate. These are older, more potent NSAIDs but come with high GI risk. Rarely used as first line today. Ibuprofen has a half-life of about 6 hours. Meclofenamate, only 2 hours, but still high toxicity. Let's summarize. Fast-acting strong NSAIDs, diclofenac, ketorolac. Best for long-term use, Meloxicam, Celecoxib. Low-risk everyday use, ibuprofen, naproxen. Once-daily options, oxypropiroxicam, meloxicam. Remember, use the lowest effective dose for the shortest duration necessary. Always consider a patient's age, GI history, cardiovascular risk, and renal function. Thanks for watching. I hope this gave you a clear, evidence-based view of how to choose the right NSAID, based on both science and clinical experience. If you found this helpful, give the video a like, Subscribe for more rheumatology breakdowns, and drop a comment if you'd like me to cover another medication. I'm Dr. Rezaian, and I'll see you in the next video.